potential victim. But the good news is that everyone is a potential solution. Sensitize the masses to sanitize. Keep a social distance and quarantine. Stop.
Thank you very much. That was a simple sample of sensitization. I'm here today. Today is 5th of April 2020. Sorry. So my name's Emma. I'm happy to be on this channel. I'm from the community of refugees and immigrants. I was resettled in Chicago in 2017, and I've been working so hard, working very much closely with entire communities of refugees in different events. But right now, around this COVID-19, I think everyone has to make sure that help each other. So I'm here standing with refugees and immigrants during this time to ensure that they also get information. I hope me being here, providing information to refugees and immigrants, as I myself part of it, I think it will bring a change or a difference in our community. And I'm not alone. I have a team behind me helping me to bring good information to refugees and immigrants. Today I want to talk about COVID-19. I'm speaking this in English. I'll come back with another episode in another language, and I will continue interpreting more information in the language I understand. And I'm not doing alone. As I said before, we are going to have very many other people at the team to help us interpret the information to reach down to our people. So let's start today. This information is about COVID-19. What I know right now or today, everyone is feeling. Everyone can feel the effect of this virus, and it's very important to have good information. I'll talk about information today that comes from the Center of Disease Control and Prevention, the World Health Organization, and the Illinois State and Chicago City government. We are doing real research to ensure that we bring something that is real. First, what is coronavirus? Let's start from the beginning. I know we shall keep developing it, but I want to give a simple definition about coronavirus as we are all understanding. What's coronavirus? According to the World Health Organization, coronavirus is a virus that can cause illness in animals or humans. In humans, coronavirus can cause respiratory infection. The coronavirus that is affecting the world right now causes the disease called COVID-19. COVID-19? What's COVID-19? COVID-19 is an infectious disease, and it is a new virus, meaning it was not known to humans before this current outbreak, which began in Wuhan, China, December 2019. According to the World Health Organization, the most common symptoms of COVID-19 are, I've listed them down here, having fever, tiredness, dry cough, itchy and pains, congestion in your nose, sore throats, diarrhea, and many others. I understand these signs it's relatable. It looks like other signs, same signs for other diseases. However, these are most of symptoms that have been identified with the disease of COVID-19. Symptoms start slow and keeps growing to more and more problems. And most of people recover COVID-19 without going to hospital. However, about 1 in every 6 people who get COVID-19 becomes very ill and has a problem with breathing. People at high risk. Who are those people at highest risk? Based on the research that most of our medical personnel trying to find out, people who become very ill with COVID-19, older people, people who are old, people with other medical problems, so people like who have like high blood pressure, people with lung disease, heart disease, HIV, stroke, AIDS, cancer, diabetes, asthma, and many others. So I know let this not scare you so much, but this can help you at least understand the level of how you can take cautions of yourself if you have some of these medical problems around you or in your body. According to Illinois government, if you have symptoms of COVID-19, the first thing you should do is to call your doctor, PCP, primary care provider. I know everyone has it, so please call your PCP to ensure that that they provide you with medical attention, and make sure that you ask for interpretation. If you call, they will always they will help you to arrange medical treatment. If your symptoms are mild and you do not have high risk for complication, like you are elderly or have other medical conditions, if you don't have all this, you will be asked to isolate yourself at home during your illness. Isolate at home, what does that mean? Isolation, what does it mean? It means that you should remain at home and you should not physically touch any other humans. The reason you will isolate at home if you are sick, but you do not need hospitalization, is because it will help you not to spread the disease to other people outside in the hospital. Okay, the reason why they need you to stay home, they don't want you to infect other people, so you can isolate yourself as the treatment goes on or as the disease keeps going away. Have serious symptoms like difficulty breathing and cannot wait to talk to the doctor, you should visit the emergency room at your area. Please, if you feel like you won't wait, please try your best to make sure that at least you call 911 or use any other means to make sure that you're reaching the hospital of emergency. You go to the hospital, please, I encourage you, ask for interpretation so that they can get the real information you have, or the historical problem of your medical problem. You need interpretation in order to understand how you can explain yourself. Okay.